comments via the question box or the chat feature throughout the course of the webinar. We're going to address as many of them as we can at the end of the webinar, although there are over 430 of you on the line, so we probably won't get to all of the questions. We will have a record of all of the questions, and we'll make sure that we get those handed off to our policy team so they have a sense for what kinds of questions are out there in the field. And finally, in case anyone is wondering, I'm sure at least one person has asked this through their question box already. The slides for this presentation are not yet available online, but they will be. Hopefully either by the end of today or sometime early on Monday. We're going to chat out the link where you'll be able to find those slides, and we will try to get them up for you as soon as possible. And with that, I will hand it up over to our Deputy Assistant Secretary, Linda Smith.
Thank you, and I just want to welcome everyone to this call. It's amazing that we have this many people on the phone on Friday afternoon, especially from the East Coast, Friday at 4. So we really appreciate the interest and enthusiasm for this. I want to start out by, first of all, certainly giving our thanks to Congress for, I think, the vote of confidence in the early Head Start child care concept and idea. We're very appreciative of the fact that they set aside, gave us in the appropriations bill, $500 million to implement this program. And I want to put this in perspective that in the tight budget arena that we're working in here in Washington, this isn't an insignificant investment. In addition, obviously, funding back or giving us the money back for the cuts from sequestration to both child care and Head Start, and then COLA. And on top of that, giving us the money through the Department of Education for the to begin the pre-K process of building competency out in the state. So again, a great opportunity from Congress, and we really appreciate it, and we appreciate your interest in this. Just want to speak just for a second about the President's Early Learning Initiative. I hope all of you have seen the materials that we put out on that, and the Early Head Start Child Care Partnerships are one piece of the President's Early Learning Initiative, and obviously the other pieces of that include the Maternal and Child Health Home Visitation Program, and we see that as the entry level into the early childhood system in this country, eventually continuing on with the partnerships that we're forming with this money to the pre-K initiative that we hope to see and on into the schools. As most of you know, we work in very close partnership with our friends at the Department of Education, and we will be working with them on the other funding opportunities as we approach that. I want to just make note of the fact that, well, this is an opportunity right now to do something significant in these partnerships. It is not just a single program that we're trying to stand up here. This is a major shift in what we think is the federal vision and the federal, strategy for finally beginning to build and finance the early care and education system in this country. We are following on and building on the lead of the states, especially in the pre-K initiative. I know I watch the press clips, and it seems like every day, at least every week, another step or another state is adding money into the pre-K initiatives around this country. So we're basically taking the state's lead when it comes to pre-K and trying to build on that, and in doing so, thinking about how we encourage states to expand and finance at least the 4-year-old programs in this country. With that said, then our money here at the Department of Health and Human Services can be leveraged and expand the services for those births through 3. So with that, that's where we're headed with this. I say to people here, and we have talked about it a lot here at ACF, that it's a sort of like turning a large ocean liner out there in the sea. It's going to be hard work. We know it. We're trying to think this through very carefully, and that's what we want to hear from you today towards the end of this call. The goal of this program is more high-quality early childhood infant toddler spaces, and I think we just want to put that out there and make sure that everyone is with us on that. And we want to get those through partnerships between Head Start and child care. We started out here at ACF a few weeks ago thinking a lot about this, and one of our first things that we did here was to get our staff together and basically brief each other on what is early Head Start, because child care folks don't always know what that means, and in some ways it sounds scary. On the other hand, if you've worked in Head Start and you've dealt directly with grants to local programs, you don't understand the process used for the Child Care and Development Fund, which is radically different from the Early Head Start grant-making process. So what we did was brief each other, and that's what we're going to start out with today, is briefing you on what does Early Head Start look like, what does Child Care and the CCDF Fund look like, do a little more background on these programs, talk about who can apply for them, and then go on to look at the partnerships and the criteria for them, and then we'll open it up to questions and answers. So where do we start with this? Well, in the 2013 State of the Union, as you'll recall, and I mean 2013, not 14, the President mentioned this in terms of looking at and moving towards how we reach more low-income children through Early Head Start child care partnerships. So over the last year, we've obviously been working on this, and then lo and behold, we did get the funding through the Appropriations Act that I mentioned earlier. So this will be these will be discretionary grants offered through the Office of Head Start grant-making process, and there will be priority given to those who come in and apply for the money and demonstrate serious partnerships between child care and Head Start. As I've said on other calls, this will be a nationwide competition with enough funding to fund programs in every state, territories, and tribe. So we're very fortunate to have the amount of money that we have, and we're looking forward to a robust grant process. So what are the Early Head Start child care partnerships about? They will support states and communities in expanding high-quality early learning opportunities for infants and toddlers. Early Head Start applicants who demonstrate partnerships with other child care providers, and when we say this, you don't have to be an Early Head Start grantee now, but you will become one if you apply for the money and are successful. You will be then an Early Head Start grantee. It's demonstrating those partnerships with child care providers who agree to meet the higher quality standards. And finally, to enhance the early learning settings for all children. And I want to just take 1 minute on that one to note that we expect to see many children help directly with the funding, and as we get into it, we'll talk a little more about that. And then we expect to see, if you will, the spillover from this affect even more children than those directly funded. So if we have a teacher in a classroom who now has higher qualifications, all of the children are going to benefit from that, not just the children who are paid for directly by this money. So I want to just turn it over here in a second to Andrew, who's going to talk you through the Child Care Fund, but to say to you that one of our priorities in what we're doing right now, above all, we want to be, number one, as transparent as we can be in the process that we're going through, and we want to be as inclusive as possible. We've been taking questions from as many people as we can and meeting with as many people as we can, and towards the end of this you will see how you can make comments to us through an email address or submit suggestions. We will take all of those into consideration towards the end of this, and we will try to answer as many as we possibly can. So again, we want to be inclusive and hope that if you know people who haven't heard the briefings yet, if you can share the information and where they can get it, we would certainly appreciate it, because we want as many people to be as excited about it as we are here in Washington. So with that, I'm going to turn it over to Andrew, who's going to talk to you about the Child Care and Development Fund.
Thanks. We're in the Office of Child Care, Director Shannon Rudisol and all the rest of us are really excited to be working under Linda's leadership and with their colleagues in the Office of Head Start on this exciting opportunity. And so this information is going to be very basic for those of you who are familiar with CCDF, but for those of you who are more familiar with the Head Start, early Head Start side, it will be useful background, we hope. So the first slide here just gives an overview of some of the basics of the Child Care and Development Fund, which some of you may also know as the Child Care and Development Block Grant. And just want to highlight that the program really has a dual purpose, both to assist low-income working families to have access to care to support their work, education, and training, but also to support the children, the quality of child care, so to promote children's early learning and development. And here on this slide, just highlights that children, parents, and child care providers all benefit from CCDF. And this slide also highlights some of the hallmarks of the program, which is that there's a continuity across, a continuum across the age span, all from birth through age 12, that there's an emphasis on parental choice and supporting care that parents choose out in the market. And these hallmarks of the program can really benefit from the partnership with Early Head Start, which brings to the table comprehensive services, a commitment to family engagement, and more continuity and stable funding. So together, they will go even further than we can on our own. So the next slide gives some basic facts about the program. We have a large number of tribal grantees, 260. Many of those are consortia, so it serves almost 500 federally recognized tribes. The overall funding is $5.2 billion in federal money, and then states bring their own money and TANF funding as well to the table. There's a lot of flexibility in the program, which is something that we really want to highlight because that creates huge opportunities for partnerships and to create integrated, coordinated services. And we'll, in the couple of slides, we'll highlight some of the areas of flexibility. There's a lot of data on this slide, but we think this is a really important background, so I'll try to walk you through it. The last column all the way to the right shows the total figures for children under age 3 in the CCDF program. So that's the group of the same age group that's eligible for Early Head Start. And then the columns to the left are for the sub-years under that. But if you just go to the far right-hand column and look at the totals, you can see that CCDF serves over 400,000 infants and toddlers. So that's significantly more than are currently served through Early Head Start, and really demonstrates that these partnerships have the ability to really expand the reach of programs that meet Early Head Start standards. The hours, the average monthly hours of kids in care are 162 hours. So they're in care for lots of hours. So again, it's a real opportunity. Unfortunately, the subsidy amount is fairly low, $462 a month, which annually that's about $5,500. So that's a real challenge for providers to be able to provide quality services on that amount. But again, that's the opportunity of this partnership to bring additional resources to the table. 64% of the infants and toddlers in CCDF are below poverty. So that means they're eligible for Early Head Start. So many of the infants and toddlers are eligible for Early Head Start. You can see that about almost 70% of the infants and toddlers are in center-based care, and a little less than 30% are in family child care. But that 30% represents a large number of family child care homes because each of those homes is caring for only a small number of children. So we're looking at partnerships both in family child care and centers. Just to note that these are the national numbers, so the figures in your state may tell a different story, so we encourage you all to look at the data in your state as well. On the next slide, this highlights areas of flexibility under the CCDF program that states can use to help support partnerships in their state. They have control over eligibility policies, policies related to co-payments, payment rates, and then investing in the quality of care. And all of these areas of flexibility can help to support the continuity of care and quality of care. And the next slide gives a little more specificity about particular ways that states could set policies that would be supportive of partnerships. States can help identify children who need services that would be early Head Start eligible children. States can help stabilize family subsidies. Right now, we hear that too often the subsidy is not a reliable funding source, that families cycle on and off because they become ineligible. But states can adapt policies to help stabilize that. They can align eligibility periods with early Head Start. They can lengthen the time between redetermination. They can eliminate unnecessary hoops that families have to jump through. They can provide care during periods of job search. So there's ways to stabilize the subsidy. States also have the option to waive co-payments for families below the poverty level for the early Head Start population. Early Head Start does not have co-payments, so that's a policy that helps support coordination if co-pays are waived. And finally, just to mention that although CCDF is largely provided through vouchers, states have the option to enter into grants or contracts for slots, which may provide a more stable funding base. This slide just highlights Office of Child Care's quality framework, which includes both pathways to program quality and pathways to professional development. So there's both the program level and the practitioner or worker level. The pathways for program quality include quality rating and improvement systems that over half the states have developed. States could crosswalk that with early Head Start standards and see where there are gaps or how well they align. The pathways to professional development includes professional development systems. A lot of states have professional development registries, which you can use to look at to see what are the qualifications of child care providers in your state, how big is the gap between how the qualifications that child care currently has versus what they need to have for a quality partnership. And so these are just areas that we'd encourage you to start looking at. The next slide talks about CCDF health and safety requirements, which is a foundation of the program that we've been working to try to make a stronger foundation. And states also have licensing standards. And I won't read through all this, but you can see that this is another area that we can be looking to when we're looking at partnerships with early Head Start and aligning the programs. So in addition to subsidies, states make significant investments from CCDF in quality improvement. And so they spend $1 billion a year on quality improvement activities. And a particular note, states collectively receive $100 million a year specifically set aside to improve the quality for infant and toddler care. And those funds can be used to support partnerships as well. The next slide gives some specific examples of how states have used their quality improvement funds for activities that are particularly relevant to these partnerships between early Head Start and child care, to develop infant and toddler credentials, core knowledge and competencies for infant and toddler caregivers, and then special networks of infant and toddler specialists. So that's a quick run-through with some of the highlights of CCDF, and when we have questions at the end, I'm glad to answer further questions, any questions you have about that.
Okay, so now we'll turn it over to Anne from the Office of Head Start, and she's going to talk to you about the Early Head Start program and what that looks like.
Good afternoon, folks. Well, actually, we're probably the old folks on the block because we've turned 50 this year, Head Start. And certainly, if you go back to the founders, the forefathers, our purpose and mission is the same today as it was 50 years ago, and that was to promote the school readiness of low-income children. I think even in the very beginning, the tenets of Head Start were comprehensive services, knowing how important that health, mental health, to name a few, and working with parents was critical to a child's readiness and preparation for school. About 20 years ago, we had the birth of Early Head Start, and I think if you take a look at the second slide, there is a particular emphasis, if you see the first quote, to provide family-centered services. Even though Head Start has always been, parents have been integral, had been seen as the child's primary educator, I think when we took on the operations, when we began Early Head Start, we really wanted to enhance the emphasis on family-centered services. And I think for those in the child care world, we know how important it is to connect with families, particularly when you're caring for infants and toddlers. If we take a look at the scope specifically in design of Early Head Start, and this is all from our statutory language, I think the departure from Head Start is when we emphasize the continuous, intensive, comprehensive child development and family support. And that meant year-round services. Most of our Head Starts are part-year, but for Early Head Start, we started out with year-round is important for continuity of care and caregiver. Clearly, I think there was enhanced emphasis on how important the parent and child interactions were within an Early Head Start center. Again, promoting parents in their roles as the primary educators. And again, I think for us the challenge was this is an opportunity in Early Head Start for us to make as early identification for children that may have some special needs. And I think this has always been a challenge in Early Head Start because unlike preschool, where many children came already identified and referred through Part C, we were getting the children first and finding 6-7 months after they were into the program that they had special needs. So this means a very deliberate approach to screening, observation, and assessment of the infants and toddlers, something that we think Early Head Start can really be a positive influence throughout the child care community. The partnerships for, the options for the partnerships, clearly center-based options, we see this as a wonderful opportunity to expand family child care options. It is currently an option within Early Head Start, but only about 1 to 2% of all our grantees, and there are 941 around the country that offer Early Head Start, have adopted the family child care option. So we see these partnerships as a terrific opportunity of enhancing family child care homes. The third is if an agency wants to come in and say, gee, we would like to both have some center-based child care partners, and in addition, we want some family child care partners. So clearly that is an option that an applicant could consider. The next slide takes us to our Head Start performance standards, and I know that that is a Code of Federal Regulations. It's a live link. I'm not sure I'd want to click on the link because they can be very daunting. And as Ms. Smith reminds us, we could have organized those in a little bit more better fashion for the reader. And what we're going to do in the next couple of slides is take you through, I think, the very key areas that are going to be the priority areas for the partnerships. Because indeed, the goal here is over time, and I think we have an 18-month window, we will provide the supports necessary both from the grantee and the partner's own capacity building that they will in fact meet Head Start, Early Head Start requirements within that 18-month period. If you take a look at the next slide, this is the big overarching summary of all the areas in which we have Head Start regulations. Again, that was quite daunting, but if you look at the diagram to the right of that, you'll see the intersection between the early childhood development and health standards, the family standards, and again, I think the thing that is important that I think early Head Start can be supportive to many child care centers is the program design and management. And I say that because we know that many child care centers don't quite have the business backgrounds, and they do in fact run small businesses. The average grant the average Head Start grant in this country today is over $4 million. So that really is, this is they running a business. So we want the comprehensiveness while the acknowledgement is truly, you need the business practices and the oversight to be successful. The key requirements in the next slide really speak to the ratios and group size. I think it's very clear, 1 teacher for every 4 infants and toddlers, with a maximum group size of 8. And that means there is a discrete area that no more than 8 infants and toddlers are with 2 qualified teachers. We also have ratios in family child care, and you can see there 1 provider, a maximum group size of 6, with no more than 2 under the age of 2, and provider and assistant, the max group size of 12, with no more than 4 infants and toddlers and only 2 under 18 months. If you take a look at the staff credentials, and again, we know that many states have requirements that child care staff have their CDAs. We require that every early Head Start teacher has a CDA in infant and toddler, is credentialed in infant and toddler, or has a state certificate that is commensurate with the competencies in the infant and toddler CDA. I think we can also flip over. And the key requirements, and again, I think these are the biggest messages in terms of what we think that early Head Start has been a leader on. It is the continuity of the primary caregiver, the continued eligibility. Clearly, for early Head Start, if a baby enters at 2 months or 6 months, that eligibility is maintained throughout the child's 3 years. We're talking about providing continuity of care, and in the best place is continuity of caregiver during those 3 years. Again, full-year services. And you all, the folks in the child care community, probably have a better understanding of what full year is than early Head Start. One of the things that I think these partnerships can have a huge impact on, and this is in the area of, I think, teacher support and teacher training, supporting staff to ensure they have an evidence-based curriculum and teaching practices, ongoing child assessment, clearly for early identification and individualization, that's critical, and again, the continuous program improvement. What do we know about the children? How are they progressing? And if they're not progressing at a rate commensurate with their own developmental skills, then we need to figure out what course corrections we need to make within the classroom to improve the quality of the educational instruction. There are, early Head Start has always had a very significant health component, and it's not that early Head Start does everything, but they must be the brokers to see that these things are done within certain time frames for the infants and toddlers. And I think if early Head Start could spread these kinds of services across infant and toddler care, I think this would be a great gift in really enhancing the quality of care across, even beyond the children in these partners that are just eligible, that are the eligible early Head Start, for all the children in the child care within those centers or homes. If we could flip over, again, family and community partnerships has always been important, engaging the parents, providing training for the parents, and that's something I think that probably parents would want to avail themselves of, and many parents would be very excited. If we are flipping down because we want to get to your question, so who will, the details about the application and funding, how will the funds be awarded? Basically, this will be an wide open, robust competition, as Linda said, throughout the country, and we will fund them through the Early Head Start grant process. So the Office of Head Start, in close partnership with the Office of Child Care, will be the funder of these awards. The eligibility issue is really, I think this is incredibly wide open. We're talking about including tribes, territories, community organizations, nonprofit, for-profit, state and local government. I can hardly think of anyone that might not be eligible to apply. And if we take a look at the details on the workforce, clearly we asked ourselves this question 20 years ago when we began Early Head Start, will there be enough qualified infant and toddler teachers for this expansion? We believe that the funds available will help to support the professional development and the attainment of CDAs and other credentialing for the infant and toddler workforce. So again, this is going to be a big priority for these funds. Will child care teachers be paid the same as Early Head Start teachers? We certainly want to close the gap in terms of the differences, but I think the pay, it's got to be commensurate with if we're achieving the same level of standards and requirements, then I think that really speaks to the pay needs to be the parity, the equal pay between Early Head Start and child care. It may not be there immediately, but I think over time we hope to close that gap. And again, what training requirements will teachers need to meet? This is where we talk about the 18 months. We acknowledge that the changes are not going to occur overnight. We have been given a grace period where there's a lot of deliberate planning, where the Early Head Start program and the child care provider have really worked out well before they're even beginning to this official partnership. What's going to be expected in the first couple of months? What could we expect in the first 9 months? What is the Early Head Start provider going to do? What is the child care provider going to do? And I think, as Linda has said many times, and I echo, this is the first time, and it's extraordinary that real money is being put on the table. We're not asking people to partner without funding, so there will be the funds to support these activities. Again, I think we want to wrap it up. Ways you can help. Get out there, talk about it, talk to your community members, assess your own organizational readiness. Is this something that you think you've got the capacity to do now? So I think we want to, and I think what we're doing, you'll see the follow the funding opportunity announcement. We expect it to be out sometime in the spring. We've got a panel late fall of 2014. And we will be making the decisions in early 2015. So I think, Linda, I know I feel like rush for time, but let's get into questions.
Before we do that, I want to add a couple of things to what Ann said. In terms of will the child care teachers be paid the same as Early Head Start, I want to make sure that people understand that the purpose of these funds are to be passed through so that child care providers are receiving the funds. And as Andrew said earlier, and I try to say that these are averages, and Andrew said that as well, but on the national level, we're paying about $5,500 per space for a Head Start or for a child paid through CCDF funds. In Head Start, that number is about $12,500 on average. Our goal in this is to clearly make up the gap between what those child care providers are being paid for through CCDF and layering on top of that money enough money to bring them to parity with Early Head Start. So I want to make sure that everyone understands that the goal and the purpose of these grants is to get that funding to child care providers to allow them and enable them to raise their quality to what we expect. I think in the past some of you could say, well, we tried partnerships and they didn't work. Well, when you go and ask somebody to do a lot more work and they don't get anything for it, and they're already barely getting by, there's no incentive for them to improve that quality and spend that money. So our goal is to get that money in the hands of people who need it to raise their quality. So when I know that as we get to the questions, there have already been a couple of questions about this, and I want to make sure that people understand. One of the questions that came in is, what is the total funding amount available for Early Head Start? there is one pot of money, and the money is for early Head Start child care partnership. That will be the priority. And so we will be working out the details about how that comes about. But the goal of the funding, as defined in the Appropriations Act and as expected by all of us, is not that there's a separate pot for early Head Start and a separate pot for child care. It is one pot. And then there was a follow-on question about who will be accountable for maintaining the quality. How does the panel foresee a Head Start program being accountable if they do not have overall fiscal responsibility? Well, you will. When you pass through money and you contract or have a relationship with a child care provider, in exchange for that money, that child care provider will be expected to meet the, the qualifications, the standards, etc., over, as Ann said, the 18-month time. So there will be accountability, and whoever the grantee will be the one holding the partners accountable. So in exchange, again, for that funding. A couple of other things I wanted to say in terms of the ways you can help. We really do want you all to go out there and apply for and be a part of this process, of getting it out there, finding partners, and coming in together. One of the things that we're very interested in is looking at your community, not just looking at what you yourself may be doing in your own neighborhood, but look at your community and where is the need, and how can everyone in the community get together and think about this and use this money wisely. The next thing we are going to be recruiting for is the reviewers for these grants. And we desperately want to have people who have infant toddler experience and who come from the child care side of the equation, so that when we panel these grants, that we have someone with early Head Start or Head Start experience, as well as someone with early child care and infant toddler experience, so that we have that balance and sort of fairness to this process. So if you're interested in being a reviewer, we'll be getting more information out very shortly. That training will be here in Washington sometime this summer. And then I think the rest goes for itself. We're very interested in how groups, especially the philanthropic community, can help people with understanding how to apply, helping them with grant preparation, helping them with needs assessment, and so forth. So I wanted to make those additions to those two areas before we take any more questions.
Linda, could I comment on, the grantee saying, well, how can we be responsible? And I think clearly there's got to be agreements up front, and it's not only what child care has got to step up and do and agree to, it's what the grantee has also promised to do, because we expect there are going to be things that the early Head Start in their own oversight and infrastructure will be delivering to the child care. And if over time, these are going to be 5-year grants, if over time the child care provider is not able or willing to keep half of the bargain, then you're not locked in for a 5-year period. We would expect there to be a very informed and deliberate decision-making process that would say, under these conditions, the partnership will no longer continue. We hope that these will all be successful, but we know that it's unlikely that there might be, it's likely that there could be some that are not. But that's in your pre-planning and your pre-nup agreement to have an understanding of when it's not working, that the partners can part.
Another question that came in is, will there only be one project per state? And the answer to that is going to depend on the grant applications that we get. So our hope is that we have at least one in every state, but there is certainly more money than one per state. Again, I want to stress that if you apply for, let's say we have only one in a state and it's a high-quality application, then that certainly would be probably funded. If we get one and it's a low-quality application, and then we won't fund that and we'll move on to higher-quality applications. So the commitment is, as you keep hearing me say, high quality, and how we get there is, it's going to depend on the quality of the application. I wanted to also clarify one thing, and it came up in another webinar, and I can relate to this since I once lived in the state of Wyoming. So let's say that we have a minimum number of children that we need to serve to have an efficient grant application. And we assume that to be somewhere around 72 children need to be served through the partnership. And you can say, well, I live in Wyoming and there aren't 72 children in my infants and toddlers in my town. We know that. But this is where thinking outside the box comes in, and thinking about how can I do perhaps a hub with units around the state so that we get to the 72 children that we need to have a grant application, but it's a single grant. So there are many ways to think about this, and in the next probably month or so, we're going to be coming out with webinars that are going to help you with that and giving ideas on different things that could be contemplated as you think about how you put your partnership together.
I can answer if you want me to take these two. One, if you're currently a Head Start program and not an early Head Start grantee, are you eligible to apply? If you just think of yourself, if you're an entity that has experience in early childhood, you can come in and apply to be an early Head Start grantee and identify partners that you will be partnering with. So the answer to that is yes. Now there's a second question that has a little bit of a twist. Can an existing Head Start program develop a parallel child care service and partner with itself? This is not about new child care slots. If you're an existing early Head Start program, it's not about you coming in for money to create a brand new child care. It's about partnering with an existing child care and enhancing the services for the infants and toddlers in that partnership site.
Andrew, do you want to take the two that?
Yeah. So we got a couple of questions about from a state the county administered or locally administered where they have the discretion to extend eligibility for up to a year to better align with Head Start, to support Head Start collaboration. But the county, the localities aren't taking advantage of that. And so that's a barrier to partnership. Also, apparently, they require monthly income check-ins and monitoring and documentation, which is a hardship for families. So the question is whether or not there should be a waiver from those CCDF requirements. And I don't think there's really, these grants, under these grants, we don't really have the authority to waive the CCDF requirements at the state level or at the local level. But what we are encouraging is for states and localities to look at their policies and to make sure that they're supporting partnership and to think about changing if they're not. We issued program guidance about policies that support the continuity of care, subsidy policies such as job search periods, longer redetermination periods, and we issued a proposed rule last May that would change and federal requirements so that states would have to adopt some of these policies. So in the meantime, we hope to be having a final rule coming out this year. In the meantime, this continues to be an area of state flexibility that will continue to provide technical assistance and encouragement around, but it really is, at this point, still a state-level decision.
Sure, there was a question, can churches apply for funding? We have, as grantees right now, we have many, for example, in New York City, many civic organizations, and there's nothing that we would see that would prevent the church making an application as an entity that said we're capable of being an early Head Start grantee, and we can partner. So I don't think there's anything, we don't believe there's anything that prohibits a church from applying.
Well, this is Linda, and I know we're getting close to short on time here, and I do need to scoot out of here in about 5 minutes. So I wanted to, we'll take a few more questions after I depart. But the one thing I did want to impart to the audience is that we have been giving a lot of thought to how we can support you through this process, and so these webinars are just a part of the starting the dialogue. As soon as we get through the next couple of weeks, we will be starting a series of webinars that will be nationwide and that will be archived. And what we will be doing is going through and helping people understand this is what the federal grant-making process looks like. This is, how different things work. Those will be archived for you so that when you get to the process to actually apply, you can check back with those and have more information or have them at your fingertips. We're working on what we call Early Head Start Child Care 101, which will consolidate the requirements into one document so it's easier for people to understand it. And said it is difficult to find them on, right now because they're throughout the early or the Head Start standards. So we'll be doing that. We're working on a series of issue papers that we will be putting out. So things like grading and blending. How do we do that? I know that we've had some discussions around supplementation. Is this double dipping? The short answer to that is no, it's not. We consider this layering money, one fund on top of another, but we'll have some information out to you on how you would account for that money in those two different streams. So we're working on a lot of things. If you have thoughts and questions about what other things we can do to help you throughout the process, let us know. We are looking right now also at our TA system and what we can do that when we finally award these grants, we will have technical assistance to help the new grantees be successful, because our whole goal in this is for you all to have partnerships and for you to be successful at them. So I think there's one other question that I'll take before I get out of here. Is, will any of the $500 million be used for conversion of Head Start floods to early Head Start? No, probably not, because the goal here is on expansion, not conversion at this time, and the conversion process would mean that it's an existing grantee getting another amount for their same grant, and we can't confuse those two things. So again, it is a new grant. It's not a renegotiation of an existing grant. So don't confuse those two things. So just to be straight on that. So I am going to have to leave, but again, thanks to everyone. We've got many really good questions here, and we'll continue to work on getting the answers to you all as we move forward. And thanks again for your time on Friday afternoon.
And you want to take a couple more? We must have a lot of Head Start grantees on, because some of these are very specific Head Start questions, and let me dismiss the myths. If you are a current grantee, many of you are expressing, I don't want to do this because if I take this grant and I get in trouble, then I have to be in DRS. And there are several questions here that sort of reflect on that concern. Whatever grants you have now from the Office of Head Start are separate from the grant, if you're successful, the partnership grant. We want these partnerships to be successful. Let's say there's a partnership grant that is not successful, and it reached the level of one of the conditions. It could be that grant would be required to recompete for another 5-year grant, but it would not impact your other existing grants. So I think we want to be very, very clear about that. I think there was another one about, will they be monitored separately? Yes, these will be grants that, we might go out, and if there's a Head Start and a partnership grant in the same location, we might combine some for efficiency, do some things at the same time, but we would be, again, these would be monitored for their own merit, their own progress, and that's, I think, why it's so important to have very well articulated agreements about what both partners. An early Head Start grantee is going to have a lot of responsibility here. and what they're doing and living up to their commitments, what the child care is doing, and if it's not working out, we don't expect people to hang in 5 years when it's a miserable situation. So we just want to say that, and hopefully give people some confidence to get in and really do it. Will dollars be included for oversight and management? I'm assuming that the person asking is saying, we're the lead agency, and we're turning over lots of this money right directly to the child care providers. Can we keep some for ourselves? Again, it's all in the plan. We suspect that the lead agency may be wanting to have create some positions possibly to be the family service workers that are able to serve the families and the child care partners, and the early Head Start agency may decide that they want to hire those people. There could be a mentor coach that you're going to dispatch to all these centers. But again, it's in the plan. These are not yes or no. It's what's the deliberate plan that's going to lead to the success of the partnership. That's really what's important here. So we don't want to say, oh yes you can, or no you can't. It's what's the deliberate plan that is going to that will give us the best opportunity for ensuring success. I think there was another one that we partner with ourselves. And again, certainly we know in tribal communities, one sovereign nation, we expect that the child care and the Head Start will be partnering together. We think that there are some situations we might have large umbrella agencies, there may be some large cap agencies, I think of some United Way, some YMCA, where they're very large and they have both Head Start and child care, and probably the two have never spoken. They might be in different parts of the city or the county. In those cases where there has not been a partnership established, we think that those are reasonable to come in, but again, it would be with a deliberate plan of how the funds would support those partners within, the child care partners within that entity coming up to early Head Start standards. Andrew, do you see what, and again, we've got many more questions that we're going to be able to get to, and we probably can take answer a couple more.
There was one I don't know that we touched on about will programs be contracted directly with family and center providers or through an intermediary. And I think the ideal was that it could be either or. So, for example, some areas have family child care networks that might be a good partner in order to reach family child care.
And I think if we could just take one more, and I think this is really, I think, a really excellent question, and one that is really the person really has a vision long term. And is there assumption that children transitioning into preschool means formal preschool outside of child care, or could the preschool experience still be their same child care program? We know that once these children are aging out of these child care settings that have been enhanced to meet early Head Start requirements, we would like to be assured that every one of these children are transitioned into the highest quality preschool experience possible. One would hope possibly that there might be some spillover effects within the same agency. We would hope that the infusion, even of the early Head Start dollars, would be helping to support some enhancements even to their preschool teachers. Clearly, if we're doing training of teachers on curriculum or child interactions, there's nothing to prevent even all the teachers employed by that agency joining that training. That being said, if one's looking at a plan where children be transitioned, I think the thoughtful plan for continuity is important. Thinking about, is there a Head Start, a local Head Start that I want to develop a partnership with? Are there some emerging preschools within your community, within the public school? I mean, really, again, that's going to depend on the community needs, what the early child care systems are. I think what we have control over right now is the money is on the table to really do some great things in the infant toddler setting, but we still want to be mindful that those investments we made there are not eradicated or eroded when the children leave. So I love the question because it really, the person's really thinking about continuity of care over the spectrum, and that's where we want to be. I think right now we're probably a little bit selfish just focusing on this particular partnership, but the question is a great one.
Okay, well, we're knocking up on the end of our hour. Thank you for everyone who stuck in, especially on the East Coast. This is the fastest drop-off we've ever had, right around the hour mark of any of our webinars, and I guess that we'll teach us to do a Friday afternoon webinar. Thank you so much for sticking around. We chatted out not only the website, at which the PowerPoint and other resources will eventually, hopefully soon, be available, but also an email address that you can continue to submit questions and comments. There was a Federal Register notice that asked folks to please submit their questions and comments to that address by the end of the day. But if you continue to send them in, we will, for as long as it's reasonable, continue to pass them on to our policy folks so that they know what kinds of questions are coming out in the field. So with that, we will thank our presenters again. Thanks all of you for getting on, and wish everyone a wonderful weekend.
Thank you.